In the summer of 1518, people in Strasbourg began dancing in the streets without a celebration, a procession, or a clear reason to stop. Later retellings turned the episode into a medieval nightmare, hundreds dancing for weeks, bodies collapsing, and 15 people dying every day. But the surviving record is thinner and more complicated. The outbreak was real. Strasbourg's authorities reacted to it. The city's response changed as the behavior spread, yet many of the details repeated today entered the story later. To understand the dancing plague, we have to separate 3 layers: what contemporary evidence supports, what later chroniclers added, and what modern historians used to explain the event. Strasbourg was not a remote village. It was a wealthy, politically independent city inside the Holy Roman Empire, governed by a council and connected to regional trade. It was also a community under pressure. The preceding years brought poor harvests, expensive grain, illness, and fear. Religious belief shaped the way people interpreted misfortune. In the Upper Rhine region, Saint Vitus was associated with a punishment that could take the form of compulsive dancing. That belief does not prove why anyone moved. It does explain why witnesses might recognize an uncontrolled dance as a meaningful and frightening symptom rather than random behavior. The familiar story begins with a woman called Frau Trophia stepping into the street in July and dancing for days. Her name and the precise timetable are not equally secure across the earliest sources, so they should be treated as part of the later reconstruction rather than a perfect eyewitness transcript. What the record does support is that dancing behavior appeared, drew attention, and expanded enough for the city government to intervene. The authorities did not initially frame it simply as criminal disorder. They consulted medical thinking and treated the dancers as people suffering from an illness. Physicians working within humoral medicine reportedly described the problem as a natural disease connected to overheated blood. That diagnosis sounds strange now, but it mattered politically. If the body contained an excess that had to be discharged, then stopping the motion could seem harmful. The proposed solution was to let the afflicted continue until the condition exhausted itself. This was a policy based on the best framework officials believed they had. It also transformed an alarming private symptom into a public program. Accounts describe the council directing dancers toward designated spaces and arranging musicians. Some reconstructions include a wooden platform and attendants intended to keep people moving. Every detail is not documented with the same confidence, but the broader reversal is clear. Authorities first enabled dancing and later tried to suppress it. That first policy may have created a feedback loop. A person already frightened by scarcity, disease, and the curse of Saint Vitus could now see the feared symptoms staged in the center of civic life, given a rhythm, an audience, and official attention. This is where later numbers become tempting. Chroniclers and modern popular histories sometimes describe several hundred participants, often repeating a peak of 400. The event may indeed have become large, but exact totals are not a census. The city did not leave us a verified list of every dancer, when each person joined, or how long each episode lasted. A responsible reconstruction can say that the outbreak expanded and disrupted Strasbourg. It cannot turn every later estimate into a precise measurement. The same caution applies to deaths. The most famous version claims that people died from strokes, heart attacks, or exhaustion, sometimes at a rate of 15 per day. Recent source criticism points out that contemporary evidence does not securely document that death toll. Absence of a list does not prove that nobody died. People who were malnourished or ill could have been endangered by prolonged exertion, but a possibility is not a count. The claim that hundreds literally danced themselves to death belongs to the legend, unless stronger evidence appears. Why did the dancing happen at all? One popular answer is ergot poisoning. Ergot is a fungus that can contaminate rye and produce convulsions, hallucinations, severe pain, and restricted blood flow. Medieval communities did suffer ergotism, but the fit here is weak. Severe ergot poisoning often makes sustained, coordinated movement difficult, and a contaminated food supply would not naturally instruct many people to express distress through the same culturally meaningful activity over an extended period. The other major explanation is mass psychogenic illness, real physical symptoms shaped and transmitted through stress, expectation, and observation rather than a shared toxin. This does not mean the dancers were pretending. Psychological distress can produce involuntary movement, pain, fainting, and other bodily symptoms. In Strasbourg, extreme social pressure existed alongside a shared belief that a saint could punish people through dancing. The first visible cases could provide a recognizable script, and the city's public response could make that script more powerful. Mass psychogenic illness is therefore plausible, but it is not a diagnosis recovered from a laboratory sample. We are looking backward across 5 centuries through incomplete documents. The surviving evidence cannot tell us whether every dancer had the same cause, whether some imitated others consciously, or whether illness, hunger, neurological conditions, and expectation overlapped. Historical explanation works best here as a hierarchy of fit. Ergot struggles with the pattern. Collective stress and belief explain more. Certainty remains impossible. As the first policy failed, Strasbourg changed direction. Officials restricted music and public dancing, with exceptions for established ceremonies. Accounts then describe afflicted people being taken toward a shrine associated with Saint Vitus, where ritual actions were intended to end the curse. From a modern perspective, the religious treatment may seem like another mistake. Within the community's belief system, however, it could also provide a socially accepted ending. The same culture that supplied the feared symptom supplied a ritual for recovery. The outbreak faded from immediate crisis into memory, and memory changed it. Later writers filled gaps with dramatic detail. Modern summaries compressed uncertain sequences into a clean story. One woman, hundreds of followers, musicians, non-stop dancing, mass death, then a miraculous cure. That version is easy to repeat because every beat escalates. The archive is less cinematic. It contains competing records, uneven dates, and officials changing their minds. But that messier version teaches more. It shows how a diagnosis can alter the behavior it describes. The city did not merely observe the dancers, it built an environment around them. By giving the symptom space, rhythm, and visibility, officials may have increased the number of people who recognized themselves inside it. Public health history contains many cases where expectation changes symptom reporting, and where institutional attention can unintentionally amplify a pattern. Strasbourg is not a perfect modern case study, but it is an early warning about feedback between belief and policy. It also shows why source criticism matters. A strange event attracts precise claims because precision feels authoritative. 15 deaths per day sounds more convincing than an uncertain record, even when the uncertainty is the honest conclusion. Asking where a number first appears is not pedantry. It changes the moral picture. The documented story is about suffering, civic confusion, and a community using the frameworks available to it. The legendary story can reduce those people to a grotesque spectacle. The dancing plague of 1518 was neither a simple poisoning mystery nor proof that medieval people were irrational. Strasbourg faced a real outbreak of unusual behavior. Officials tried a bodily explanation, then public dancing, then prohibition and religious ritual. Modern historians can connect the pattern to stress and shared belief, but they cannot inspect the participants or reconstruct every case. The strongest conclusion is not a single diagnosis. It is that bodies, expectations, institutions, and stories interacted. 5 centuries later, the episode survives because it seems impossible. The better reason to remember it is that the mechanism is recognizable. A frightened population saw a symptom that carried cultural meaning. Authorities responded in a way that made the symptom more visible. Later storytellers made the result more dramatic and more certain. The dancing stopped, but the feedback loop continued in the history written afterward. Strasbourg's records do not give us every answer. They show us exactly why we should be careful with anyone who claims they do.